Researchers indicate variable blood pressure in adults in their 20s and 30s may indicate a higher risk for heart disease later in life. Analysis found that 3.6 mm raised in blood pressure in young adult was associated with a 15% higher risk of cardiovascular disease events in later years. The younger adults need to have blood pressure measured at least once a year. Those young people with variable blood pressure should adopt lifestyle changes to lower their risk of cardiovascular disease. The existing guidelines defining hypertension and assessing the need of medication ignore the variability in blood pressure readings. It has been long believed that the variable in blood pressure could have been due to chance. But the recent studies suggest that it may be not. The long-term data from a research suggests accordingly. The research involved 3,394 participants. Blood pressure was measured at the initial examination, and then 2, 5, 7, and 10 years later. They were followed up at 15, 20, 25, and 30 years. The researchers found association between variable blood pressure readings before age 40 and risk for cardiovascular disease. In the follow-up period there were a total of 181 deaths related to cardiovascular disease. Variable blood pressure readings in between visits could help identify the people at risk. The study included white and African Americans. These results may not be applicable to other racial or ethnic groups. The reason behind the association of blood pressure variability and increased risk of heart disease is still unknown. So, the experts believe there is need for more research before changing the existing guidelines. We also have variations in blood pressure measurement techniques around the different parts of the world. Hypertension is also called as the silent killer. Some people may have headache, shortness of breath or chest pain. But some people with high blood pressure show no symptoms. If these kinds of symptoms are seen, you should immediately consult with your healthcare provider to assess the condition properly. The takeaway from this study is that the normal young adults should also have their blood pressure checked at least yearly.